Right. So we have this Y tool, which is the wooden, what we term it as a myokinetic tool. Also, this is also instrument assisted because this is also an instrument. You see, even cupping also, why can't you say that it is instrument assisted soft tissue mobilization? You can't tell. Because this is a tool which assists the soft tissue mobility. Why are we, I don't know why we are discriminating. Historically, ISTM started from chiropractic. Okay. Graston, Ergon, different companies, they all only that stainless steel. This is wooden. And you know wooden tools, how you can efficiently keep and you can get a better grasp on the fascia compared to a stainless steel tool. Okay. And this is like a hand grip. And if I don't have my thumb also, you will know that this is like looking like a thumb. Okay. If I remove that and I keep this versus, you'll feel that it looks like a thumb. So that is why it is thumb myokinetic tool. Usually we give the ischemic compressions, we give trigger point releases with the thumb. So we can give with this tool. This is also instrument assisted, myofascial release, trigger point release. And here, this was for direct release, like the herniated trigger point dysfunctions or the trigger points. Whereas this, the concave, deeper concave, the shallow concave, and the concave or convex. Okay. All the surfaces are there in this Y tool. Here, you can see that the narrow portion, smaller region, forearm mandala I can use. You can see that there is no gap between the tool and my forearm. So it molds the fascia totally. And then when I give the release, if I relax my fingers, or if you are touching my finger also, okay, you will feel the movement of my finger. Or the tendons. The extensor tendons which are there in the wrist. So it is because it is the fascia that is gliding. That's why I feel the movement here in the tendons when I do this. If I do this, which everybody does, all the instructors, at least in India, or even universally, the IASTM, what they teach with the lubricant and then they do, not on the wooden, but on the steel. What they do this, and you palpate the tendon that time. That means I keep the tool here. Imagine that the tool is here. I just put it into my shirt. Okay, so tool is here. And I feel the tendon during that technique. Two techniques I do. One is this. Nothing will happen to the tendon. It will just staying there, sleeping there. Patient also will be sleeping. Because it is massage. Soft tissue mobilization. But if you see this and this and this with the tool, you know that this tool actually extends my thumb and my index. Okay, so like this. But my web space cannot be that much molding to the part. So this tool adds on to the efficacy and I can do the myofascial gliding very effectively. If I glide the fascia proximal, I cannot flex. If I glide the fascia distal, flexion automatically will improve. So this is the mechanics of using these tools. Most important than why I am giving these two tools. One is direct, other is specific releases. This is specific release, muscle specific releases, region specific releases. This is direct on trigger point. This may be used around the trigger point also. Why these two? Look at these two. Where am I keeping? Yeah, okay. Both these tools are congruent. Here also, some extent here, okay, around 75%. And you see that here also. Okay. So that means all three sides, one or the other region of this thumb tool is congruent. So I can keep here like this, or keep here like this, or I keep here like this. When they are congruent means they are paired. This is what we have actually revealed or unveiled in the functional IASTM course. Nobody tells you use two tools in the world. They use only one tool. Nobody uses the tool for release. They use for massage with lubrication, stainless steel. And nobody uses a wooden tool together with the black metal or wooden tool with the bronze. Different materials of tools used together. It's only the AOMPT, and I'm giving an open challenge. If at all any instructor in the world has done that before August 2022, show me that video. Let's have an open debate. Let's have an open challenge for the whole world. AOMPT is the world's leader in online manual therapy education, not just online. It is when the whole world was dying with COVID. We are a group of people who have kept on learning, and we have evolved the existing techniques into better techniques. We have taken new techniques and we have explored the better application of those techniques, and also ensured that everything is under the domain of physical therapy. Even for trigger points, I had actually shown one of the demonstrations, which even our two members will remember, that I can use even this instrument for the trigger point. This is the chiropractic activator gun. Same like how the activator tool is there. So chiropractic we are not using. We are using it as chiro manual adjustment therapy under physical therapy. We don't improvise only physical therapy. We improvise even chiropractic and osteopathy, and we use it under physical therapy. This is the relationship which is like a surrendered, unconditional relationship with knowledge, what this academy has. And of course, feedback from all the clinicians, members who are doing the courses, using it on patients, getting back with webinars, case webinars and discussions, interactions throughout. Not just the 262 free webinars, it is about 2,600 plus live streaming hours of courses, which no academy in the world can even dream of in just 2.5 years. With also holding free webinars every country. We held 28 countries, we took the free webinars. Masterclasses, practical webinars for each physios in every country, 28 countries through our chapters. So don't think that it is just something which is coming and going. AOMPT is a phenomenon. And that phenomenon is worth exploring to change your own life, your transformation guaranteed, that before AOMPT and after AOMPT, it will be totally different. And that difference will stay forever in your life. It's not just 3 months and after that you have to do the course again. Never. You do any course of AOMPT, you can develop your own techniques after that. So that is what we think it is the actual treasure of human potential. As a physical therapist, we should not be narrowed down by techniques. We are the boss for the techniques. Techniques should not control us. We as a clinician should decide and combine the tools. So for example of a combination for a lateral epicondylalgia, I can keep one for the fascia. Okay. I know I'm doing a self demonstration, so it will not be possible to see. But if you have both hands, both with the tools, you can imagine one hand is holding the fascia glided and the other hand is holding the tool, the thumb myokinetic tool like this. Here, I am just putting inside the bracelet here symbolically, just to show that this tool is there on that place. And this thumb tool will go here to release next to the Y tool. So that means Y tool is in place and the thumb tool goes to actually release that along the margins. So between that, there is a taut band of the extensor carpi radialis brevis. So that means one side the C, other side the thumb, and I do the release, which is more sustained pressure, deeper pressure, not the soft tissue mobilization or the massage. And if I'm using both together, I will glide it or I can stretch, but I will never allow the tool to do the massage. Also understand that for deeper tissues like ligament or capsule and all, you cannot do IASTM. You should be sensible enough. When that capsule is subcutaneous, easy to palpate, like joint line, knee, patella, ankle. But you cannot treat a hip joint capsule with IASTM. So think logically that tissues which are deeper, the best treatment is dry needling. Best means, if you want to actually go there. Otherwise, indirect techniques, like moving the part, loading the distraction to the joint and all that. Okay, so mobilization of the joint for the capsule and all that. You cannot give a direct force to a deeper structure. We are not doing surgical physical therapy. We can only do pre-surgical and post-surgical. So think, when you are getting a question, don't put a hypothetical question which is like unrealistic. At the same time, a ligament, strain, sprain, all that, whether you want to do IASTM, it's not the first choice. You have various other better techniques. So it is not like just because you have to use the IASTM, don't think like how IASTM used for bursitis, how IASTM used for tendinitis, how IASTM used for myofascial trigger points, how IASTM is used for periosteitis. Okay. You have to see that different spectrum of pathologies. IASTM will not come as top priority everywhere. IASTM will only come if layer to layer you want to separate, as I told in the beginning of the session, or it comes as structure to structure you want to separate. It is not like a deep transverse friction massage, which actually you think that it is important for the tissue healing. So everywhere you keep IASTM, then only tissue will heal. Deep tissues you use even pulsed ultrasound, that is enough. Collagen fiber reorganization, all that. But for that ultrasound, don't remember the functional ultrasound therapy. Wherever you touch, there is a signature of AOMPT in that. When it comes to physical therapy, even the electrical stimulation is functional, neuromuscular, functional TENS, functional ultrasound therapy, which nobody can imagine. So, and the mechanisms always come everywhere. Without that, you cannot treat the patient. So these two tools are, of course, are provided for the people who are participating in the FASCICON, so that they can get a feel of how using the tools for myofascial or the fasciomuscular or the myokinetic approaches. So try to see that it's not like one tool will treat all the conditions or one technique will treat all the conditions. It is you who decides. You are the one who can treat all the conditions. And the only tool that can treat all the conditions is the tool that is provided by God. Your own hands. Only the tool IASTM extends or increases the efficacy of your hand. So that should be the goal when you are using that. And don't get misdirected by the commercialization of the tools distribution or also the courses. Okay. And definitely those who have I am going to share this short video for the people, everyone, so that they realize the importance of the FASCICON and also the myokinetic specialist, the myofascial kinetic specialist course, which you're going to go have in Coimbatore, plus also the emphasis of the difference between instrument assisted massage versus instrument assisted myofascial release. Okay. And how functional IASTM of AOMPT is really patient centered. Most importantly, myofascial pain is a bigger picture, like different mechanisms: central sensitization, sympathetically mediated pain, peripheral sensitization, and nociceptive, together with what is called as the cognitive affective mechanism, which is the last option, diagnosis of exclusion. So wishing all the participants who have already enrolled the FASCICON, definitely they have made the best decision of their life. One thing I'll tell you honestly, I come from Tamil Nadu, and I always envision that I should teach the best of the best to the people, the physios of Tamil Nadu, because it is my home place. And this is going to be something which is like a journey into the space, a visit to the moon. Okay. Please ensure that your friends in Tamil Nadu definitely should utilize this opportunity and not miss the event, the phenomenon that is going to happen at Coimbatore. And every one of you are best in your own way. So focus on excellence, not on perfection. Perfection is according to the others. Excellence is according to your own conscience. So build up your excellence and do your best for your patients, because patients trust physical therapists more than any other doctors. Every patient will tell that. So be patient-centered. Tomorrow, when I am a patient, they will treat me with empathy, rather than a certified practitioner who is technique-centered. We always have clinical courses in the AOMPT. So welcoming you all, and it's good to have an extended discussion and interaction on this IASTM and also on the myofascial dysfunctions. So I close this part of the recording.